Hello. Can you guys hear us?
We are live.
All right.
We are live.
Okay. All right. So this
can
is
you
episode
mute your mic?
4.
There should be a little mic there.
Who you want to mute? Oh, Anessa?
She's already on mute. She
Unmute.
kind of froze though a little bit. There she goes.
Okay. Go ahead, Pete.
Okay. So this is episode 4, and we are having an interview with Doctors Andre and Anessa Acuña. Give a shout out, guys.
Hey, everybody.
All right. This is Dr. Sergio Martinez and my wife, Dr. Rocio Martinez,
Hey,
on the
everyone.
Surge PT podcast. So today we want to talk about what our letters mean behind our names. I know that, there's a lot of confusion of when patients are looking for physical therapists. They never know what kind of therapist to seek out. And I think, learning the therapist credentials is very important. That way you can get the care that you need and care you deserve, especially in the outpatient setting. So let's talk a little bit more about that. So Andre, give us a rundown of what the letters mean after the PT, because everyone knows what the PT means, and that's physical therapist. But what about the Dptsi? And I see you also have some letters there. Let's talk about that.
Sure, definitely. So essentially, the PT is first and foremost the identification of what you are or who you are, right? So we're a physical therapist. And then anything after that essentially goes off onto say what type of education or extra certifications that you may have, jumped on after your essentially your graduate program, right? So in my particular case, I'm a doctor of physical therapy, and when I came out of PT school originally, it was mostly master's programs, right? Back in 2007, it wasn't really till about 2015, I believe, that almost all universities or programs transition to doctorate level physical therapists. But I had an option. I had an opportunity to go back and get the extra, classes and whatnot for doctorate level. So that's what I did. And then after meeting you, Dr. Sergio, you inspired me and drove me to look into getting my fellowship training. And so I went and joined the IAR, which is Institute for Athlete Regeneration, and completed the didactic portion of fellowship. And so in my particular case, the FIT is Fellow in Training. Essentially, I'm 95% done with all the fellowship curriculum. I just need some more fellowship mentor hours by yours truly, and I should be able to get the completion of my fellowship training to have the FAAOMPT letters behind my name, just like you do, Dr. Sergio. And then CSOMT for me particularly is certified in sports and orthopedic manual therapy. So there will be a lot of COMTs, and which are certifications in orthopedic manual therapy, and mine is more specific to sports related.
Awesome. Yeah, so the FAAOMPT, it's a little bit of a mouthful, but it basically stands for Fellow of the American Academy Orthopedic Manual Physical Therapy. And what that means is that we did, 2 years of residency at the minimum after our doctorate in physical therapy school, and then a 1-year fellowship. In that 1-year fellowship, we do have to do a certain amount of hours, anywhere from 190 to about 400 hours, depending on the program that you're in. And you have to do a research project. You have to do testing. You have to be pretty much on your toes with your mentor all the time, because you're going to be asked questions, and we're going to be grilled on, anatomy, biomechanics, treatment options, differential diagnoses. So let's talk a little bit more about that, Andre, like with your experience in the fellowship, mentorship program. Like, what are things that for an example, would you say that, okay, I was able to differential diagnosis even though we got a referral for something completely different?
Right. Well, essentially, I've been practicing for about 14 years now. And before the fellowship training, it was a lot of just what my experience and what I would research and read up on my own to help drive me to provide the best intervention that I could for my patients. And, I can maybe just start off by saying this. When I was in PT school back from 2003 to 2007, there wasn't too much research or evidence-based type of applications within the U.S. from what I recall, right? We had a lot of research journal articles from like the UK or from Australia or from other, continents around the world, right? But we were reading a lot of their journals to kind of see what applications were best for the cohorts and all the kind of studies that they were doing, right? And it was growing more in the U.S., but it wasn't necessarily like always, or essentially right now you can just Google something here and it shows case studies done here in, the U.S., right? Something that is pretty cool that I essentially found when I got into my fellowship training is that a lot of our instructors were actually now citing research and science studies that were being done by people within the U.S., right? And some of those cited researchers were instructors of mine in school, right? So maybe that dates me a little bit, but it was pretty cool to know that they were starting those research, particularly those research studies while I was a student in PT school, and now they got it published and all that kind of stuff. And now the newer grads of doctors of therapy are actually learning on those articles because they've been around for 14 years or so, right? So it's something that I have been able to it's kind of like, I think of like the internet, you know what I mean? Like we went from this dial-up kind of AOL kind of running man, and dad get off the phone, I need to use the internet, to now everybody has it in their pocket, you know what I mean? And so it's been that growth and that tradition, that transition that I've seen to where now I'm just really happy with where our industry is headed as a whole, because the evidence and the research is within our own people in our own soil and land, more so than what I recall back then, right? But essentially, what happened was when I first met you, Dr. Sergio, and you worked alongside me, I saw your application, your approach, everything that you had been taught from your fellowship was just very on point. It really just cut out the what ifs and the maybes, and so your differential diagnosis was just really applicable to give the best skilled intervention to the patient. That at that moment, it wasn't like, well, let's see where the next 2 or 3 weeks takes us. It was like, it was test retest. Where does it hurt? It hurts right here. Okay, let me do something. Boom. Okay, try that again. Does it hurt? Hey, my pain is gone. And I was like, whoa, man, I need some of that cereal this guy's eating. You know what I mean? It was just like, it was very direct. And essentially in my case, even though I was trying to find all those answers through my trial and error and application, and it was still essentially, it is effective, it was just like, how do I shorten down the time? I don't care to have patients here for 3, 4, 5 months. Like essentially, traditionally, that's the general kind of thing for physical therapy. It was like, hey, if I can get you better in 6 sessions, I'll get you back to your quality of life. You get to go spend time away from the PT clinic because you're back to doing the things you love to do. And hey, I love you, but I don't want to see you again here for this particular injury. Think about me for the next one. Send a friend, send the family, And so that really is what got me to say, hey, you know what? I want some of that. And so, you inspired me and you drove me to say, I haven't been in school for 14 years, but I'm going to do it again. And that's what I did with the loving support of my wife and those around me. It's really helped me be very, very truly proud of where I'm at today with these credentials and proud of our industry because, another thing, the doctor initially right off the bat, you know, we even had word of people within our own industry here locally, like, well, he's a doctor, but he's not really a doctor, right? It was kind of like that whole Cairo kind of like, Chiros aren't really doctors, right? And it's just kind of like, no, man, they worked hard for what they get. You should respect that, right? How come we can call a professor doctor with no, we don't have any kind of like hesitation, but then you see Dr. PT and you're like, no, he's a PT. No, well, essentially, yeah, we're saturated with a lot of physical therapists here locally early on. Now it's starting to kind of balance out the scale, but essentially, yeah, before there was not doctor level PTs here in our area, but we encompass the, essential knowledge, skills, responsibilities of advanced physical therapists as fellowship trained and extra certification. So we're not just physical therapists anymore. It's transition, and then so like if people say, well, why call you doctor? It's like, well, because that's the title I took. But, we underwent specific professional practices just like any other dentist or nurse or doctor or surgeon or optometrist. Orthodontist. I mean, we went to that. It's rigorous. They're not just handing out PT licenses to anybody. We are smart individuals. I tell people all the time, you meet a physical therapist, you can't throw them a challenge without them accepting that challenge. And that's somebody that you want in your corner. And the differentiation is just knowing, hey, respecting that they went above and beyond because they're now a Dptsi, and then you see certifications and you see fellowship trainings and residencies, and it's like, no, they put a lot. I could have just stayed back as master's physical therapist and said, I'm not going to invest my time, I'm not going to invest money, I'm just going to get paid, sit back, get my salary. But I felt that we owed more to our community, and just as science changes all the time, everybody just look at the pandemic, right? COVID. We didn't have COVID vaccine this time a year ago. In 1 year, we got COVID vaccine. Science changes, right? So does the application of physical therapy and rehab and prevention, performance enhancement, and wellness. I could go on and go on, but my wife needs to talk now.
I wanted to, if I may, I wanted to also ask if Dr. Anessa Acuña's experience was the same. What was her journey like going through school? And was it a doctorate PT, or did she also do advanced after school, advanced work after schooling?
Yes. Well, when I entered school in 2010, right, it was already a PT Dr. PT program, right? We were the second class at that time. I went up to West Texas. It was a little bit of a culture shock, of course, growing up in the Valley, but definitely very challenging. Luckily, I had my husband. Well, he was my fiance. No, not even my husband, my boyfriend at the time, to help me guide me through, because it really was, like he says, not easy in any way, shape, or form. So then being there for 2 years, coming here and being able to come back home for the rotations was really nice. And being back home and, living at home and home cooking and botanas and all that good stuff. So, training after you and I, right? We've done our pelvic health training, level 1, level 2. So we're still growing and, learning and all of that. So,
yes. Yes, go ahead.
No, go ahead.
Yes, I was going to say, with the culture shock thing, I definitely agree, because when I started school in Belton, Texas, that was back in 2015. Before starting school, we went to check out the area, and people were looking at us like, what are you doing here? You don't belong in this area, right? So I definitely agree that just that area alone, just whatever area you're at, there's a culture shock for sure, and just learning their traditions and all that, right?
Yeah, it was. Wow. Yeah, luckily I had about three classmates at the time that they were married and they were older, so they kind of not older, but like a few years. And so I was able to find my little group and then, go to the store and, but it was definitely, I got a few looks. Not sincerely, but that's just the way it is, that's how it goes, unfortunately. So,
and not to take away from, the difficulty of the profession, right? The PT itself it's a beast. And I say that because I went through respiratory care school. That was my bachelor's. And I supported my husband through school. At the time we were fiancés, and I didn't know that PT was as hard as it is. PT school was as hard as it is because I went through a bachelor's program, and so I was thinking like, okay, it should be that hard. Come on, like let's.
Oh yeah.
It's a doctoral program, guys. So definitely, I experienced that in jumping from respiratory to PT. I went through that schooling, and I'm like, whoa. What is going on? Like such more rigorous coursework, and so amen to that. Yeah, to Stephanie. Yes. So don't think that because it's a doctoral that it takes away from the difficultness. I'm sure bachelor's was just as difficult. But like for me, I went through a bachelor's of respiratory care, and that was difficult. But doing a doctoral level work, it's so much more rigorous for that to obtain that doctoral degree. And so you were able to graduate from it. You deserve to be called a doctor because those credentials are not easy. Like Andre was saying, they're not easy to obtain.
Yeah, we had our fair share of late night studying. I know when Rocio went back to school to get her PT degree, I felt like I was going to PT school all over again too. I was like, oh my God. She's asking me
I know. I
questions
told him
all the time.
I apologize for not knowing how difficult this was and giving you a hard time with those late study, sessions. But it's like, whoa, it was a big shift for me.
And when we talk to aspiring therapists, because we like to mentor students a lot, that essentially say, hey, doctor, I want to be like you one day. It's like, we have very much open door policy. We won't turn anybody away. We can't accept everybody at the same time, but essentially if you have some time to wait, we'll make that time for you. But I tell in preparation of all these students, I say, what, in my particular experience, when I was doing 16, 17, 18-hour semesters at UTPA, right? UTRGV now, but UTPA, I was just trying to get through my undergraduate because, I was taking courses like marine botany, right? Or biology, whatever. Like, I didn't know why I needed to be knowing what seaweed was what, but it was an upper level bio course from my, and I was just trying to take 16, 17, 18 hours to get to the next level. But at that point, I was doing a lot of memorization to get me through one test to the other. And plus everything was just so rapid and stuff. And then it was like once PT school hit, like after orientation day, I was like, okay, cool. First day of school, right? And I was like, okay, well, we're going to take the first 2 hours to kind of read through the syllabus. And then we're going to do like a meet and greet. And we're going to be like, hi, I'm so-and-so from whatever. And then, no, man, my first class, it was like, okay, everybody put your books down. As you read in the syllabus over the summer, you should have read chapters 1 through 6. We're going to have a test today. Like, what?
Right, that they wanted you to be prepared even beforehand.
So
for us, we all went through lecture based. Sergio did a problem based program, and he was a guinea pig for sure because it was our first class. So
so just think about that. So it was no longer memorization; it was learning, right? It was learning. And so when you guys kind of talk about how when Dr. Rocio went back to school and Dr. Sergio was like, I'm back in school, I kind of felt the same way. But what helped me with Dr. Anessa was like, that information was still in the Rolodex there. Yeah. And it was like, man, I learned that. She would come up with me with some case study presentations, and I would just kind of like, you know what, you're going to want to think of like, bone tissue, bone, cells depositing in muscle tissue. And of course, we know the diagnosis of that, but it's like, how did you know that? I was like, it was in that Rolodex because I learned it.
Okay, I have to say I love that. Usually I use Therapy Toolbox like as my, but I like the Rolodex thing. I think I'm gonna start using that too.
Yeah, there's a never-ending Rolodex, man. You keep adding to that thing, right? Yeah.
Well, I call mine the glacier, you know, because I got penguins on there, you know. Unfortunately, with my glacier, though, is that when a new one comes in, an old one comes out. So, you know, I forget stuff. But you know what? Like, it's all good.
Yeah, but it's encouraging because we do have some students, PT students currently going through school right now watching us. And, you know, just words of encouragement, like keep going strong, right? I mean, this is tough. So I remember going through one of my rotations was in a hospital setting, and it's like, it's very different, right? I don't know if any of you guys have ever done an acute rotation, but you're not called the doctor in the acute setting. It's like the physician is the doctor and the therapist is the therapist. And so I can see how in some of those settings, yeah, there's more of a shadow cast on the PT, that doctoral degree, right? Whereas for the outpatient setting, when I did rotations in the outpatient, it's like, it's welcomed, right? It's welcome to be, especially the private outpatient settings, you want to be letting and educating patients that you are a doctoral level, you know, physical therapist, because the level of care is different. It's much more rigorous practices that we go through. And so even after schooling, right? So you're talking about all these other letters after the name. So just to let, you know, the community aware that those other letters mean that there are other additional credentials and further practice work that therapist has gone through to help you out in a better way, right? To be a more well-rounded therapist or to specialize further into that area. So we're always trying to learn, right? With more letters that are being added to our name.
And definitely it's another kind of like we're living in that whole like shift or like that paradigm shift of just being the therapist to doctor. I'll share with you guys early on in my experience back, you know, in the early 2000s. I would walk into a brand new evaluation. I was doing home care at that time, but you know, we'd come in with a particular diagnosis, and you know, I know the protocol and I know what you can and cannot do, but it's our job as therapists to teach or to let the patient trust us that we know that, right? But essentially there'd be a understanding on the patient side. It'd be like, well, the doctor told me this, and my first, you know, or el doctor me dijo, and my first response is, which doctor? And then they just kind of like, all right, which doctor? Because essentially doctor is doctor, right? But which doctor, right? A medical physician is a medical physician, right? A doctor of philosophy and whatnot, a doctor of this. So I say, well, the doctor of therapy says that it's okay to move your knee right after a knee joint replacement surgery, right? And then so entrusting them to say, oh, wait, you're right. You know, you're the doctor for the movement, right? Because essentially, like, right, our industry is, we're being known, or we're transitioning more to movement specialists. So, you know, I'm not going to go and tell them my like medicine based opinion, and then they give me, well, the doctor told me don't take that pain or medication, and I'm gonna say, well, you know, that's outside of our scope. But as far as movement and what your range of motion and your strength and all that, like, we're the specialists for that. So let's go and move on. And so it's an educational factor, right, that I think is we're needing to start moving towards, and ourselves as clinicians are the ones that are going to change that. And so I think we've been doing a good job at educating, because I'll tell you this much, and cultural base here, and you guys all know it, I'm preaching to the choir, but it was like what God said, our creator, and then what the medical physician said, you know, and it was just like no one else could say different. And with all respect to our fellow clinicians and all, but when it comes to movement and specialists that for range of motion and pain and all that, you know, hey, we got our respect for that, right? And so,
right, and I 100% agree. That's important to let the community know that when searching for a provider, you have to also know what their credentials are. I mean, it's just what is important to your health, right? So you're going to doctor. What kind of doctor are you going to, right? Are you going to a physician assistant? Are you going to a nurse practitioner? Are you going to an actual medical physician, right? Or when you're going to therapy, okay, are you going to go to a doctor of physical therapy, right? Are you going to go to a bachelor's, a master's? Are you going to be seeing the physical therapy assistant? Are you going to be seeing the technician? So it's important to differentiate and know, right? Educate yourself on who's going to be treating you.
Right. We actually have a question right now. I don't know if you guys can see on the comments box. So it's from Stephanie Salazar. She says, in regards to credentials, do you agree that it's beneficial to introduce students as doctoral interns during the rotations so that patient can take them more serious? What are your thoughts on that, guys?
Well, let my wife take her thoughts.
Yeah, what do you
I
think?
would think it would be beneficial so that they can establish that respect level.
Because I know
not just a student,
Yeah, because I know we have like a label as SPTs when we're student physical therapists. I know that's like our dedicated credential name when we're doing our rotations. But I do agree. That I know like when I have students from PT schools, I do let patients know like, hi, she is a doctoral student and she's doing her clinical rotation here, and I'll let them know when they're graduating. That way, the patients can take them a little bit more serious, because I know that when sometimes patients find out you're working with a student, they're probably thinking like it's a student that's not even in the physical therapy program or something like that. You know what I mean? And so, yeah, I agree, Stephanie.
Yeah, I agree. And it would probably depend on the setting, right? Obviously, if you're in a hospital setting, that might be a little bit more frowned upon. I don't know. I'm just speaking from my own experience. It's an opinion. I don't know. But it's just a bigger system there. But if it's a more private setting, then if, they're welcoming to the idea, then why not, right?
Right. So let's talk a little bit more about the pelvic floor credentials and what exactly does that mean for the people. Like, pretend I don't know anything, right? What does a pelvic floor therapist do? Why should someone go see a pelvic floor therapist versus another physical therapy clinic that doesn't have a pelvic floor therapist? Let's put it that way.
Right. So Anessa and I will weigh in on this, and it's a loaded question. I'll tell you that there's a lot to say in that, right? But basically, a pelvic floor physical therapist is one who can do a true pelvic floor physical therapist is one that can do internal, vaginal, if there's a vagina, or rectal assessments of the musculature in that area, right? So we're taking a finger and we're inserting it and we're assessing the muscle function in that area. We're checking to see, are those muscles doing what they're supposed to, just like a regular, shoulder muscles or the hip muscles, right? As a regular physical therapist would, we're assessing what's going on in the pelvic floor muscles, so the muscles that control sexual function, the voiding or peeing, right? Urinating, pee, and the poop, right? So sexual function, pee function, and poop function. Yes. So controlling pee and poop. Yes. And there's so many different types of names that I've learned through my research that you get tagged as the hoo-ha doctor or the hoo-ha therapist or all these different names. But yeah, now there's so much trending on TikTok about it. But yes, basically we help with incontinence, urinary or fecal leakage, any sexual pain or dysfunction, pelvic pain, prolapse, right? So if they're feeling a feeling of fullness going down in that area, or any scarring, right, from C-sections. So it's a loaded question in that there's so much more, right, that goes into the pelvic floor. But essentially, working with the skeletal musculoskeletal dysfunction of that area. Anessa, do you have anything to weigh in on that?
I agree in regards to what you said. It's a very loaded question, right? We have so many, so Rosie and I took the courses and we're learning and practicing, but from what we have, learned and through our teaching, through being taught, was that we're just used in conjunction with, the physicians, right, that are managing several conditions. A lot of times it's an embarrassing kind of thing, and but really, when we learn about what we can do, our mind was like, right, when we were exhausted when we learned all the things that we were able to do. And you think about urinary incontinence, I see home health on the daily, and it's just like 9 out of 10 patients, everybody had, it's just the wave, but then it's educating, like, hey, there are things you can do. There are options to help. And then a lot of, postpartum, I have a lot of friends that are, hey, I have this issue after having a baby. And, so there's definitely a big benefit to what we are able to do. Like Rosie said, internal exams, things like that, the different layers that we're able to examine.
And weighing in on the incontinence piece, a lot of women that I've met, they say that it's sometimes normal to experience that, right? But it's not normal. And so that's one of our responsibilities in treating pelvic floor is to educate the community that leakage of any kind is not normal. And so getting that addressed with your provider to get a referral for pelvic floor physical therapy is important to make sure that everything is doing its job, right? Contracting and relaxing correctly so that everything that's supposed to stay in stays in, right? And that we are able to relax when it comes to going to pee and poop. And that's as simplest terms as it gets, right? When it comes to the credentials, though, there are other additional tests that you can take to become a women's a women's specialized therapist. And so there's also, depending on the coursework that you take, another exam that you can take through them, and that's a pelvic rehabilitation or pelvic, what is it, PRPC, I think it's called? PRCP or something like that, yeah. So as far as us right now taking the courses, we are able to identify ourselves as pelvic health providers, right? So we're doing pelvic floor therapy, and we did just start learning this, and it's just so amazing how much we learn and how much we learn that we can help patients with. And so it just opens up another Rolodex, I think. So we have maybe multiple Rolodexes, right? Like Andre was saying. And so there's another Rolodex in itself, right? So pelvic floor PT can be its own thing in that there's so many different diagnoses that you can target. And so
and it's not just about Kegels.
It's not just about Kegels. Absolutely not about Kegels. And that's if you even know what a Kegel is and if you're doing it correctly.
And if I may, I want to jump in here just to kind of take a moment to just kind of like any listener out there or person viewing, if you were to just Google right now, nearby specialists in the physical therapy practice, right, for pelvic health or fellowship trained, you wouldn't see too many options out there. And I want to take this time to really just, pay my respects to all of you as clinicians that wanted to better yourselves, because it's not about bettering us as clinicians. It's about informing ourselves, becoming certified to help our neighbors in our community. And we essentially, like, there's questions about what drove you to open your own business, what drove you to this, to go get more education to that. And when it all boils down to, it's because our community deserves more and better, right? And if we're not able to provide that as clinicians, then are we truly really doing what our neighbor should, right? Because for years it's been like, we got to go to San Antonio, Houston, Dallas to get that care. And we're right here, live testimonies to say we want to provide better for our own community, our family, our friends, our future. And this is why we're doing all this. I know that you guys all agree, because I see bunch of head nodding there. But try to Google pelvic health specialist, physical therapist. Not going to find too many options. Try to Google fellowship. I think the numbers in fellowship trained physical therapists in the state of Texas, I think there's 2%, I think is what I last found out. 2% of all physical therapists are fellowship trained. 2%. And then you're looking at Dr. Sergio here, fellowship trained, and then I hope to join that boat pretty soon, right? So in your community, you're now starting to get those options. And so it's really something to take advantage of, because you're going to see that the level of care that you deserve is definitely improving, and you don't have to travel San Antonio, Houston, Dallas so much for that anymore, right?
Right. So there's differences there, and really, when we talk about pelvic health, is I want to use it as I'm introducing it to the practice that I'm already in, right? So how can I help my patients with the additional knowledge that I've learned, right? And so there's many patients that I've already seen in the past that I'm like, oh man, I wish I would have known this before, because I probably could have helped them a little bit more, right? And now we have the tools to do so. Right now I can say, okay, well, I've learned this, so let me try to help my future patient or whatever. If that, and it's even better, right? Because you're becoming a better clinician. You're adding more things to your Rolodex. You're learning more as you go. And a lot of the times we're learning from our own patients as well, right? A lot of their subjective reporting we're learning as we go. So it's not all with the books, right? It's not all with the books that we're learning. A lot of it is we're learning in the clinic with the patients, with a lot of trial and error, unfortunately. Yeah.
But luckily, the trial and error has decreased significantly because of the extra training that we've done as well. Mm-hmm. But going on another subject here. So tell us about where you're at, Andre and Anessa, or where are you guys at? Yeah, I know you guys are located in Edinburgh, right? So kind of give us more information about where you guys are at, what made you all start Dptsi, what services you guys offer, things like that.
Sure, yeah. So we're located here in Edinburgh, and essentially, if you want to find out all our information, you just go to our website, www.dptsi.org. And it's going to give you all the information. We're very transparent and open with what we offer and what we do and all the services. We still had to update a little bit on some stuff, but you can always just call us to ask questions. But we're here in Edinburgh, and we are right. Essentially, you look out our front door, and we're across from the Doctors Hospital Renaissance area, Jackson Road between Owasso and Alberta. And what made us start Dptsi? Well, when it all boils down to the gist of it, it was really to be able to provide a better service for our community, but at a position where we can decide on what we want to do and what we want to offer, and necessarily bring down the essential, equipment and things that we don't see here. So we have a lot of things that we highlight in our facility that you won't find in other private practices, much less other, like maybe hospital groups or whatnot. But, we feature things like the HydroWorks underwater treadmill, the Alter G anti-gravity treadmill, the Thor photo biomodulation, cold laser therapy, dry needling, cupping, game ready, cold compression, a lot of things that, when people say, well, it's a sports institute, so I'm not an athlete. It's like, no, again, just like Dr. Rocio mentioned earlier, we're physical therapists at the beginning of it all, right? So we know how to treat many, many different type of age groups and conditions, but we have that added benefit of also featuring sports related type of injuries and performance enhancement and prevention of injury and rehabilitation. But that's essentially where Dptsi is located. And, I didn't know if you wanted to get into any more of what we offer, or just focus on Dptsi.
I want to ask, can you explain a little bit to the community about what the anti-gravity treadmill, like what that does, and And then
Yeah,
I think you said also the Thor, just so that they simply understand like what that offers.
Yeah, and that's a great question. And the reason is because, I mean, the question is, well, why, right? Like a treadmill, I just buy a treadmill at Academy and run on it, right? But I mean, or, cold laser, slap on some eyes, man, and, but no, again, evidence-based practice, right? Evidence-based practice is where we essentially have transitioned in our care. And essentially, the evidence shows that if you unload or unweigh, joints and structures of the body, then you're essentially not going to be feeding into the problem, or you're going to help prevent the degeneration or the wasting away of joints and whatnot. So we essentially felt that our facility needed to be focusing on things that evidence-based practice was telling us we needed to do, right? So we do a lot of manual stuff. So people will be like, how about decompression table? Do you do that for herniated discs, right? And our first question is, okay, is it a true herniated disc that you're having pain-related issues for, or is it a movement dysfunction in your facets of your spine, right? Because that can also mimic or mirror herniated disc-related pain, right? And so, somebody may have heard, well, my MRI shows I got 2 or 3 levels of herniations, and essentially, yeah, you do, but that's not the reason why you're having your pain today. So we do unloading, we do manual stuff to help relieve the tension in the joints, and that essentially becomes very effective for our care, right? The cold laser, infrared therapy is good for decreasing some localized inflammation and also relieving trigger points. So dry needling is also very good for muscle relaxation and trigger point related activation. So a lot of that stuff isn't seen in many practices down here, but we decided to go ahead and offer those services so that we essentially become like a one-stop shop for our community members. So another big thing I wanted to hit on was direct access. We have the direct access law, and we open direct access to our facility. So somebody essentially says, I have pain and I don't want to go XYZ. I just want to see a movement specialist to help me address my pain. Walk in our door and we'll accept you,
And Andre, can you explain a little bit about the direct access? Like what does that mean to patients?
Yeah, so before direct access became into law, September, October of 2019, was it? Or I don't know, the pandemic went by so fast. It was that last year.
I know. Last year was all COVID, okay? 2020
was all COVID, so 2019. Yeah, so essentially our direct access in the state of Texas was one evaluation. We could only evaluate. We couldn't treat. We couldn't do anything. We could just say, you know what, this is what we are identifying. Go see your medical physician or go see a primary care, primary level clinician, get a referral, then come back just so that they can confirm that what we think is going on with you is actually what's going on with you. And then
so much back and forth, right? It's like
it was a lot of that. It was a lot of that, and it was like, well, hey, my job said that I don't have any more PTO. If I miss one more day, I'm just gonna give me some stretches to do or I Googled something and then we never see them again. You know what I mean? And it's just like,
or like they go to you and they're like, wait, so you're not gonna treat me right here, right now?
Yeah. So yeah. It was in our aspect, in my side, it was like they didn't really gain the trust. They really felt like we weren't able to do everything we essentially could do to help them because of that. Well, anyway, long story short, the APTA, Texas Physical Therapy Association, the Texas Medical Therapy Association, we all went to Austin. We fought for the ability to have patients walk directly into our practice and we can evaluate and treat them. When it came down to it, they agreed to allow us 10 days as doctorate level physical therapists or having extra clinical or educational courses. We get 10 business days as a fellowship or residency trained doctor physical therapist. We get 15 days to treat the patient without the need of a physician referral. At that point, if we have not helped the patient ultimately get the results that they need or finish the diagnoses, then we're obligated to send them to a primary care to get a referral. But, we have to always put the asterisk that we are not a substitution of a primary care evaluation. We're not a medical diagnosis. We're not substitution to imaging, MRI, all that kind of stuff. It's just our physical therapy related diagnoses. And so it gives us a little bit more time to be able to help the patient and save their time and having to double book, other doctor type of appointments, so on and so forth.
Awesome.
In a nutshell.
Yeah,
But come see us and we'll be able to dive into it a little bit more and then tell you exactly how we can help. And that's essentially why we opted into seeing patients with direct access, which essentially helps us to open our doors to our community without them feeling like they cannot approach us.
And as a sports institute, do you guys offer anything specifically to athletes? Maybe a gym membership or anything like that, or wellness?
Yeah, definitely. So essentially, we always want to look at how we can help an athlete improve in performance or optimally function in their sport. And essentially, a lot of athletes that we have seen in our clinic after injury has been with, injuries related that could have been prevented, right? And so in talking to them and in studying a little bit more of like their preparatory work and things that they did to essentially get them into an injury, we were like, well, I think that there's a gap there as far as like movement-based type of identification and joints that are not necessarily positioned optimally to effectively work, right, or move, muscle imbalances, so on and so forth, right? And so a lot of things that we were identifying essentially is that when they would come to us, it was like, well, I used to go get a massage and they would help me, or I did cupping, or I did this, foam rolling, and I did that, and it would help. But then 2 hours later, the pain was there, but I had a back-to-back game, so I played it. I pitched 90 times, and oh my God, my UCL is torn now, and now I'm out of commission for the next, year or so, right? And so we were kind of like, well, what is it? What when you scale it back and you look as a doctor physical therapist with, concentration in sports and all that, you start thinking like a lot of times, and this isn't just athletes, but this is just in general, a lot of times we're like a dog chasing its tail. We are treating symptom after symptom after symptom, hoping that the problem is going to be resolved, right? And essentially, we don't go search for the problem fix because it's going to take a while. We want the quick fix, right? We're like, what have you done for me lately culture, aside from the cancel culture, where what have you done for me lately culture, right? And it's like, I want results fast. So give me medication, give me a foam roll, give me that stretch, all that kind of stuff. And we're like dogs chasing the tail instead of finding the true problem, right? And so we decided to offer our community an ability to walk into our clinic to find the problem. No more chasing the tail, no more looking for the symptom relief, just cause and effect stuff, and we've been very efficient with that and seen a lot. So we do offer athletes like a wellness screen. We offer athletes individualized, proper sports-specific training. We do have our Dptsi Fit gym that we just opened, and it's open to all our community, but essentially our coaches on staff are certified trainers in as far as like educational stuff, doctor, physical therapists, strength conditioning coaches. So there's a lot of things that are out there that we offer. But essentially, we just want to stop chasing our tail, stop treating symptoms, stop feeding into the opioid pandemic, stop, all the other kind of things that we're doing to ourselves because we want quick fix stuff, and essentially nip it in the bud right off the bat. We'll see you in our clinic with injury anyway, but I don't want you, if you keep chasing symptoms, we're going to see you in our clinic, right, as rehab. But we want to try to not lead to the injury component. We want to we want to address it beforehand. So again, as holistic-minded therapists, clinicians, we want to treat everything as much we can. We want to work towards becoming primary level clinicians, not secondary level. So we have to be able to look at the whole picture versus just treating symptoms or sticking to just the rehabilitative side as physical therapists have for so many years. We need to just address the whole preventative and all the other kind of stuff that happens before injury.
Awesome. Well said. Well, guys, I think that's going to wrap it up. But you want to give a shout out of how people can find you one more time, guys?
Anessa.
www.dptsi.org.
All right. And a phone number maybe they can reach you guys at?
Right. We're at 956-205-2704. Feel free to give us a call. That's our main number, and we can always direct you to whether it be our fitness gym, our home health, our massage spa, or our physical therapy clinic.
Do you guys have any promotions going on right now for the community, like on Facebook or anything like that right now?
Definitely. On Facebook and Instagram, you can find us, locate Dptsi. We have right now for our massage, we have our on-staff massage therapist. She's really one of the best that we feel here in the Valley. She is by appointment only, but essentially if you find our discount voucher on Instagram or Facebook, you get a 30% discount to any of her sports-related or soft tissue massages. She does 30-minute, 50-minute, and 80-minute massages. So just download that voucher and give us a call. Essentially here at the clinic, we do offer a pain discovery voucher. We have discounted rates, whether you have insurance or not. We could always run benefits on your insurance. If you have any questions on, well, does my insurance cover for physical therapy, so on and so forth, call us up. Give us your identification information. Give us your insurance information. We'll do all the legwork, find out what your insurance covers for you, call you back, let you know what they cover, and if you have a co-insurance or co-pay or whatnot, we'll do all the work for you. But essentially, we want to get you in our door. We want to help you identify why you're having pain or movement dysfunctions, and then give you options as to how to fix that. If you don't have insurance and you want to do private pay, we do have a voucher on our Facebook and social media. Basically, you come in for a consultation. We have a certain discounted rate for that, and then we discuss discounted rates for treatments and interventions. But as far as what we've been doing here in our clinic, we've been seeing great optimal results. Our patients have really benefited from what we offer. You know, their words to us is like, why didn't I do this first? I went to this place, I went to that place, I did that, and I did this. I don't know how many of them had the little huevitos over their head and the egg kind of stuff. They went to curanderas, they spent all this money. You know, they did all kinds of stuff. And then finally, day one, they come in here and they're like, wow, no one's ever told me I had that, and you helped alleviate my pain. Of course, it's not like that for everybody, but we're going to try our best to do that, just like I know Dr. Sergio and Dr. Rocio do over at Surge Mobile Physical Therapy. So I wanted to touch on one last point. You had a question there. And the question there was essentially, what is it that why the collaboration between us with Surge Mobile Physical Therapy and Dptsi? And it's a very good question. I think it's important that our community understands. You know, Dr. Rocio, Dr. Sergio own their own company, private practice. They do home mobile visits. They do home health. They do clinic-based visits. You know, they're essentially always trying to do better in their care for their community, and the same like-minded approach with Dr. Anessa and myself. We want to put the community first. And why as an out viewer, somebody looking from the outside in, they say, well, you guys are competitors. No, we're collaborators. We work in the same industry. We're colleagues. I don't look at Dr. Rocio and Dr. Sergio as my competition. I'd love for them to be right next door to me or across the street from me so we can go have lunch every day, but we can't. But what the thing is, the true honest fact is, because now I see that we have two clinicians that are like-minded individuals that like we are, and we can offer better for the community. I don't want to be the only one out there doing the wonderful work that I do. I want help, and my wife does too. And I want to be able to say, hey, my patients come in and say, I'm going to South Padre Island for the next week. I'm going to miss out on therapy, and I'm so bummed. No, you're not. Let me call Dr. Serge and let me see if they can take you in, because I know that they're going to apply the caliber of intervention and skill set that you need to help you get better, and we can help each other collaborate that way. But essentially, that's really why I thought that was a very good question that I didn't want to go without answering, because I think that we should be able to have a community of doctors, of physical therapy, just physical therapists, that we can pick up the phone and say, hey, I've got a patient. It's a family member. It's a neighbor. It's my cousin. It's my tia. But I don't think I can help them ultimately or optimally like you are. So I'm going to refer them your way. And then say, hey, I appreciate that. And then it's going to come back and forth and so on. Or it's, hey, how do we better our whole Rio Grande Valley community to offer better for our sports athletes, offer better for our geriatric athletes, offer better for our pediatric, and work in collaboration versus the patients who walk into our door every single day. I went to that person and this doctor and that, and nothing ever resolved. I think it's something that we're just kind of allowing to happen, which we shouldn't, and we got to make a change. And so this is our effort. And hopefully that rings into the ears of people and the listeners, that essentially it might be affecting those who have kind of chased their tail everywhere. But I want you to know that we have truly, it's effortless. Our connection here with Dr. Martinez's has been effortless, but it's really because we passionately put the patient first, and we want to improve our industry. So I'll get off my box now, man. But
well, no, I agree with that. I think it's a lot of the time very competitive, and there are a lot of competitors out there, very competitive nature. But when you're looking at it from our perspective, right? There's other people that maybe see it differently, but we're trying to help. We're trying to help create awareness and stuff, and we don't see it as competition, because we see it as additional help, right? We're like-minded individuals. We get to bounce off things off of each other, right? Especially when you're specializing in the same areas, and what not better thing to have than a buddy, right? And so in therapy, we always emphasize that, right? Always to have someone to support you. So the more support, the better. So I 100% agree with that, and that it doesn't have to be a competitive nature. It's just someone that has other experience that can help in the matter. So the more people we can help, the better. Yeah.
Yeah. I mean, I get text messages from, a lot of my colleagues asking me like, hey, I have this patient doing this, and this, presenting this, and this. I've done this, and this is still happening. Am I missing something? And sometimes I feel like I'm missing something too. I mean, we're not perfect, right? But I mean, that's the benefit of collaborating with other like-minded individuals who have the same passion to be the best in what they do, not just for ourselves, but for our community as well, and to make sure that they're getting the care that they need. And so I love this collaboration that we have between each other. I think it's only going to get better, and looking forward to what the future brings.
And I was just trying to get Mr. Grayson Starbuck to say Dptsi, hooray, but I don't think I connected with him in that, man. And he hasn't commented, but yeah.
So he's actually a physical therapist also.
I picked up on all his comments there, but Mr. Starbuck, can we get some credit here, bud? I mean, come on.
He's actually in Oklahoma, I think. He's a fellow as well. He went to
okay.
Yeah, we went to Manual Therapy Institute together. So yeah, he's a funny guy. He's a cool guy. He's really smart. But anyway, that's it for us, guys. I mean, do y'all have any other questions or comments before we get offline? All right. So then that's it for everybody. Thank you for listening to episode 4 with Dr. Acuña at Dptsi. They're physical therapists and business owners. We are logging out, and this is Surge PT Podcast. If you guys need to contact us, it's contact@surgemobilephysicaltherapy.com, or give us a call at 956-443-3844, or look us up on the internet, www.surgemobilephysicaltherapy.com. Thanks, guys.
And you can find us on Facebook and Instagram too. So
Hook 'em horns, baby. Hook 'em horns. Bye, guys.